Hi, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be talking about why it's sometimes necessary to have teeth extracted for braces. So let's get started. As orthodontists, we would prefer to do braces and not have to have any teeth extracted on our patients. But there are certain types of tooth and bite problems that are better treated by having some teeth removed. There are lots of different reasons why orthodontists may recommend having teeth extracted for braces, but in this video we're going to discuss 3 of the main reasons that extractions may be necessary. So one type of tooth problem that may require extractions with braces is if a patient has severe crowding. Lots of patients have crooked or crowded teeth, and luckily not all of them will require extractions. But for some patients with severe crowding, having teeth extracted may be the best option. So this patient, for example, had severe crowding on her upper arch. And as you can see, her upper canines are completely blocked out. So based on the amount of crowding she had, we determined that the best way to correct the crowding was to have 2 of the premolar teeth extracted on her upper arch. And you can see in this animation that after the teeth are extracted, an orthodontist can then align the rest of the teeth with braces and close any spaces that may remain. And by the time the treatment is finished, the spaces will be closed, the teeth will look great, and no one will be able to tell the teeth were taken out. With the patient we showed earlier, you can see that her final result turned out great. And after having 2 teeth extracted with her braces treatment, she had a beautiful smile and a healthy bite. The next type of tooth or bite problem that may require extractions is a severe overbite. In severe overbite cases, usually the top teeth are very protrusive and stick out too far forward. This patient here is a good example. This patient had actually started braces at another orthodontist office and had been in braces several years, and her overbite still wasn't corrected. Due to the severity of her bite, we recommended that she needed to have 2 permanent teeth removed on her upper arch in order to fix her bite. You can see in this animation that we will usually have the first bicuspid or first premolar teeth extracted, and then pull the front 6 teeth back into that extraction space. Once this space is closed, you won't be able to tell the teeth were removed, the bite will fit together properly, and the overbite will be corrected. Now going back to our patient, she had 2 teeth on her upper arch extracted, and then we closed that space by pulling her front teeth back. By the time we were done, she had a beautiful smile, no spaces, and her overbite was completely corrected. The next type of tooth or bite problem that may require extractions is a severe underbite. In patients with a severe underbite, the lower teeth stick out too far when compared to the upper teeth. In this patient, here's a good example. Due to the severity of her underbite, we recommended that she needed to have 2 permanent teeth on her lower arch extracted in order to fix her bite. This short animation will demonstrate how taking out the teeth and then closing the space can fix a severe underbite. For patients with an underbite, we'll usually have the lower first premolars removed, but in some cases 2 teeth on the upper may also need to be extracted. Now going back to our patient, she had 2 teeth on her lower arch extracted, and then we closed that space by pulling her front teeth back, and you can see by the end of her orthodontic treatment, she had a big improvement to both her bite and her smile. So these are just 3 examples of why teeth may need to be extracted for braces. There are lots of different tooth and bite problems, and based on severity, extractions may or may not be the best choice. The only way to know for certain if you or your child will need extractions with their braces is to have a consultation with an orthodontist. If you're living in the Phoenix, Arizona area, we would love to see you for a 100% free consultation. At this consultation appointment, we'll discuss your treatment options and whether extractions would be needed. If you have any questions about extractions with braces, feel free to ask in the comment section below. And if you found this information helpful, please give this video a like. Also make sure to subscribe to our channel for more braces related content, and make sure to tap that bell. So thank you so much for watching, and we'll talk to you soon.